I normally introduce remote care to my patients at activation, and they're pretty excited about it. So I let them know, just so you know, going down the line, this is going to be part of your standard of care with us. So you will have activation, we will optimize your processor and your hearing, and then maintenance is going to be using remote care as part of your standard of care. And for my established patients, the next time I see them, I let them know, this is part of the care that we offer now, and we will be using this. Everyone has been very excited about it.
So I like to try and introduce remote care at all the appointments, regardless of where we're at on our journey. I tend to focus on more on certain appointments, but certainly in the candidacy process, we will discuss that this is an option for aftercare ongoing should they proceed with a cochlear implant.
We would normally raise the topic of remote care once the patient has been implanted, because in New Zealand there's generally a very long wait between candidacy assessment and implantation.
In the last 12 months, one of the other things that we've done is an opt-out approach for our remote check. So this is for our recipients who we know can use it, who we know have the compatible processes, but when you talk about it in clinic, they might be, oh, maybe next time, or I'm not sure. We know once they try it, they'll be on board. So we sent personalised emails from the clinic, and we've had an incredible uptake. We only had a handful of people say, no, not for me, whereas everyone else went ahead with their enrolment and then getting those checks coming back, and then slowly then being able to introduce them to more of the remote check capabilities. So we didn't do a full baseline, and then obviously onto remote assist from there.
When I first introduce remote care to people, they often want to know if they won't be able to see me anymore. So I am quite quick at reassuring people that it's not a complete replacement for in-person appointments. And I think once I explain it carefully and share resources and demonstration with them, most people are very open to remote care. They think the technology is neat, and because we do have quite a large area that we service and a lot of people who travel quite significant distances, they seem really excited at the idea of not having to do that.
A lot of the patients that I've spoken to about remote checks and remote care have started off quite skeptical about what benefits they might receive from remote care, or whether the remote care appointments are going to interfere with the face-to-face appointments that we have here at our clinic in Geelong. A lot of these patients who were skeptical, who have gone on to try remote care, have come back with some very positive feedback, and their thoughts behind remote care has changed quite dramatically. They've started to realise some of the benefits that remote care can provide, namely being reducing travel, making sure that we can look after their processor from afar and identify if there are any faults with their processor and make sure that they're appropriately triaged and brought in for an appointment sooner.
The two main resources I use when introducing people to remote care are, there's a booklet that's been produced by Cochlear that's it's got pictures and pages and frequently asked questions that I will give to people to take with them. And the other thing I like to use is a demo version of the remote check that I've got on my own phone, and I can show them physically what it looks like.
When I'm enrolling a patient in remote care, I enroll them, or I tell them, I will be enrolling you into remote care through our clinic. If they're in person, I tell them then. Sometimes it's through email or through our patient portal. I let them know, since we last saw you, we've adopted something called remote care as part of our patient care. And I explain to them how we're going to use it, and this is new, and they've all been on board with it.
The important piece is presenting all of the facts at the time of their candidacy evaluation, reinforcing that at the follow-up visits, so the initial activation, the 1 month appointment, and ensuring that we are making it known to them that this is a resource that we provide, that it's beneficial to them. And by the time we get to a point where we're making those decisions with this individual, hey, you're doing really, really well with your cochlear implant. You're wearing it more than 10 hours a day. You say you're doing really well, hearing in noise and in various challenging environments. I think you've reached your plateau. I think we've done what we can in this moment, and I'd like to see you back in 6 to 9 months. And if we want to touch base before then, we can do it with this telemedicine tool, remote care.
Out of the patients that I have introduced remote care to, patients that are familiar with their smartphone, 100% have adopted this as our standard of care. No one has told me no, and they all love it.